state plan for the new federal child care and development block grant program. The plan has taken a lot of work on many people who's here today's time and effort, and preparation for the hearing has also been a bit of a challenge. Within the limited time frames that the federal regulations established and state law times for hearings and distribution of notices, we all have been a little frustrated in trying to get the information around to all of you and get comments back. We're grateful to those of you who are testifying today, since so little time has been made available for you to review and develop comments in response to the plan. And I might note that as you're reviewing and commenting on the plan, so are we, and we're making several changes. I won't spell them all out now, but I suspect that some of the changes will be those that you're recommending. And since we drafted this plan, we've been meeting with representatives of the Health and Hospital, or of Health and Human Services in Washington, and have gotten new rules added to the plan, so we are amending to reflect those changes. The block grant affords New York State a chance to enhance the state's ongoing efforts to improve the availability, affordability, and quality of child care services. It's critical that we make the most of this opportunity to facilitate discussion and obtain feedback on the issues and needs facing parents, child care providers, licensing staff, and most importantly, the children receiving child care services or in need of child care. To this end, the state is holding 2 hearings, one today in Albany and one on Thursday in New York City. For those unable to attend these hearings, written comments were accepted until July 15th. Before I go through a little more on the hearings, let me just suggest that we all introduce ourselves on the panel. I'm Judith Gallo, and I'm an assistant commissioner from the State Department of Social Services.
I'm Fred McServey. I'm the acting executive director of the New York State Council on Children and Families. I'm also a member of the Governor's Permanent Interagency Committee on Early Childhood Programs, and on behalf of the Council and the Governor's Permanent Committee, I want to welcome everyone and tell you how eager we are to hear your testimony. Thank you for coming.
I'm Mary Bondarin, Bureau Chief, State Education Department, the Division of Child Development Services. Good to see you here.
And I'm Charlie Brown from the Division for Women in the Executive Chamber of the Governor's Office.
Today we'll be hearing from those of you who have submitted written testimony in advance, and we've developed a schedule of written presenters. I'll call people off in the order that they're scheduled. I think you probably all have gotten that. If you didn't give us written testimony, I think probably there aren't any people who have not submitted written testimony but who would like to present. We would be glad to add you to this list. Our purpose today is to focus on specific questions and issues surrounding the provisions and refinement of the state plan. Each presenter will have up to 10 minutes to present their testimony. In the interest of time, we will limit our questions, but we have your phone numbers and we may be calling you for clarification on some of your comments. The department will be reviewing your testimony and the comments you make, and where relevant and feasible, we'll be incorporating these comments into the state plan. These revisions are occurring immediately following the hearings to allow for the state to make a July 24th application deadline in Washington, so that over the weekend we'll be changing to reflect where we can your comments. Again, we appreciate the commitment of you in coming to testify today to strengthening our child care system. Why don't we begin testimony, and Louise Stoney, who's the Policy and Program Director of the New York State Child Care Coordinating Council, will lead off.
Good afternoon. I won't spend a lot of time reading this testimony since you all can read it and we submitted it in advance. Let me just go through and highlight the points. that I think are important and give you opportunities for question. I should begin, however, by commending the department for getting this plan out. I know that you are under a tremendous amount of stress and that meeting this deadline has been a tremendous burden given the complexity of the new program. One of the major problems in commenting on this plan is that it's very vague. So what I've done is basically to make recommendations of what we think you ought to do where there isn't specificity in the plan. The first piece is around the allocation formula. There were no specific numbers included in your plan. We have attached a copy of what the legislature included and want to say that we support this allocation with two exceptions. Our first exception is in the area of training. We think that $3.8 million isn't enough money for training. The training needs in this field are tremendous, particularly since in family daycare we're now requiring training for the first time, and we're seeing increasing numbers of people coming into daycare centers with little or no training, and that often includes the directors of the centers. So the recommendation of the Child Care Coordinating Council has been from the beginning that we allocate $5 million for family daycare training and $2 million to begin training in centers. We think those are minimum needs. Secondly, we question the wisdom of allocating more than $9 million to the daycare startup program without instituting changes in the way this program is administered. You just have to take a look at the reappropriation section of the budget to see that there clearly have been problems with getting this money out to programs. The Child Care Coordinating Council was concerned about this and has spoken to a number of daycare centers in an attempt to find out what's happening. And what we're hearing again and again is that centers are finding that it's difficult to raise the matching money that they need in order to get the center off the ground, that they've lost their original site and they were not able to find another one, or that they just didn't realize how complex it was to open a center and could get a grant together, could write a proposal, thought it was a good idea, but when it came down to actually doing it, were overwhelmed by all the problems that they came into. On the other hand, if we look at what happens in the family daycare portion of the program, we're seeing increasing numbers of homes opened. And even more important, we're seeing those homes opened in coordination with local social service departments so that they are able to serve low-income children. We're also seeing those homes opened in conjunction with provider training and provider technical assistance. So it's a comprehensive package. We'd really like the department to think carefully about a similar kind of strategy for daycare centers. And what we're talking about here is looking at the idea of contracting with some sort of an intermediary agency that can really help centers package funding. And we offer for you as a model in Maine where they've contracted with Coastal Enterprises, which is a community development agency that administers loans, loan guarantees, and grants to child care programs and basically helps them put the package together. We also want to stress that we think that the concept behind the public-private investment fund that the Families and Work Institute is recommending is also a good one. And particularly the piece that we like the most about that, again, is that they're recommending to contract with a non-governmental agency that can administer the funds, assess applicants' management ability and financial feasibility of the project, provide assistance to applicants in packaging financing from a variety of public and private sources, and coordinate technical assistance. Again, that kind of hand-holding and careful selection of applicants in the beginning we think can make a big difference. In the area of child care subsidies, let me praise the department for its mandate to pay actual cost of care so long as it doesn't exceed market rate. We think that's absolutely essential. We also want to say that we fully support the proposal to allocate money to SUNY and CUNY for students that are in universities. We have several concerns about issues that are in the plan or not in the plan. One of the first ones is the issue that the plan does not require that districts set a minimum eligibility of 200% of poverty. Basically what we're talking about here is the current requirement, the current practice that allows districts to choose capping eligibility at a level lower than 200%. It creates real problems around the state in terms of inequities for parents. I know I've discussed this with you at great length, and since our last discussion, I have a new proposal, which is not included in my testimony. The concern that's been raised to me is that districts will not target the poorest of the poor if we don't allow them to set lower caps. The issue for us is we fully support districts targeting the poorest of the poor. If you want districts to target, require them to target and require them to do outreach. By that, we would love to see a campaign that has posters and brochures that describe this program in both English and Spanish and other languages. We'd like to see these posters made available in areas where low-income families are, in areas where they cash their public assistance checks, in CAP agencies, in Head Start agencies, in food pantries, in shelters, in drug treatment centers, places where people, so they know this program exists and they know how to apply for it. How about using cable television? A lot of non-English speaking communities are using cable television as a way to reach their populations, and our affiliates have found that a very good way to recruit family daycare providers. Let's put some spots on those shows, reaching out to Hispanic communities, Haitian communities, Chinese communities, basically informing them of subsidy programs and how to apply. That kind of outreach is really important, but using an artificial cap to limit it basically allows local districts to limit their participation in the program. They don't want to put in the local share. They don't raise their cap any higher than they can afford to spend the in-kind dollars, and they just limit their participation in the program. We're going to be seeing money more than double. In fact, actually, it may be significantly more than doubling if all the money that the feds are saying has to be put in subsidies in addition to the 4A. We don't want to give districts the ability to limit their participation by just saying we won't take anybody who's above 125% of the poverty, even though money is there to pay for them. We also think that the department should eliminate the option of cash reimbursements to parents for the cost of child care. If we're really committed to parent choice, we have to give parents the tools to support choice. Cash reimbursement doesn't do that. Right now, parents can get cash reimbursement under welfare reform. Many districts offer that. If you choose a provider who's outside the contract system, the district says, we'll pay you in cash. That's not a choice for families. They don't have the cash to lay out to begin with to pay for the provider. The provider can't wait. A parent can't go to a provider and say, well, I'll pay you when I get my check from DSS, which is, in most cases, no sooner than 2 months after the date that they apply. It's simply not an option for low-income families. We think that if you want to use cash payments, give cash advances or give two-party check reimbursement. It's much more likely that a provider will wait if they know that a check is coming with their name on it. This has been successfully used in some child care programs in New York City, and it's also often used in housing. We're also concerned about the fact that the plan gives districts a tremendous amount of time in which to pay providers. The plan reads 45 days from the time they get their claims data to reimburse providers. We understand that the common practice now is 30 days. And we're concerned about giving districts even more time. We also think that the plan is very unclear around how long districts are supposed to take to certify payment for informal care providers. It seems to imply that they could take the same 60 days to certify informal care providers that they can to, quote, register family daycare providers. If you add all of that together, what it means is potentially a person who chooses a neighbor to care for their child who is unregulated could conceivably not get a check before 3.5 months. Quite frankly, that eliminates an option for parents. They just can't wait that long for their money. We also think you need to look at the sliding fee scale. I know we've talked about this quite a bit in the Seamless Funding Committee of the Permanent Interagency Committee, so I won't go into that in detail, but I think that that's certainly an important consideration to make it easier for parents to transition on and off of subsidies. We think it's also important for the district to do everything they can to inform districts of their allocations as timely as possible. This year it was a major problem. We know as a result of a lot of the budget cuts and the deficits and all that stuff, but still, districts did not get informed of their allocation until almost 2 years before the fiscal year was up. That meant that they couldn't possibly plan. They couldn't get their counties to give them the matching money that they needed. You can't run a system that way. The districts need to know as soon as they can. In the area of seamless funding, we're extremely concerned about the plan in this regard. We believe that the state has an opportunity to merge funding streams here, to merge funding from the block grant, state funds, and the new Title IV risk, and to give it to the districts in one funding stream with one local match. We are totally at a loss to understand why the state did what it did. It basically is giving the districts the Title IV-A at-risk money with a 12.5% cash match when the state is using state dollars to match that. They could have given the locals that money for free, and it wouldn't have cost the state a dime. I don't understand why they did that. They're giving the CDBG money, however, at no match, and they're giving the state money at 12.5 in kind. You got 3 different programs, 3 different matches, 3 different lists, a chance for districts to basically mix and match and pick what money they're going to spend that's the cheapest. And we just really don't understand why. It seems to make no sense whatsoever. And we'd really seriously encourage you to reconsider that option. In terms of a certificate program, the plan is very vague. In the draft of the plan that I got, which I understand has been changed since then, it indicated that New York City might be looked at as a model. We would certainly encourage you not to look to the New York City voucher program as a model. There are serious problems with that program, and it certainly does not support parental choice. We think that any certificate program that, quote, pre-approves providers, in other words, the district can pick which providers are in the program, doesn't give parents real choices. You've got to look at a system that allows parents to choose any legal provider in the community. We would, if you're looking for models, encourage you to look at the current systems that are operating in Steuben, Westchester, and Dutchess County, and Delaware counties, excuse me, not Dutchess, Delaware counties. These counties do not use informal care providers because at this point, legally, they're not allowed to except for welfare reform. But for all other systems, they do allow parents to choose from any regulated provider in the community. And it's really, I think, the closest that you can come to a real system of parental choice given our current purchase of service contract system. In terms of child care resource and referral, we're extremely pleased that's part of the plan, that the department sees R&R as an important agency and system in our child care delivery network. We want to underscore the fact that we think it's essential for the state to clarify the roles of the R&Rs and to get rid of the current spend-down formula. The spend-down formula has been a real burden for many R&Rs that simply do not have anywhere near the funding that they need to provide the services. We're also very concerned about some phrasing that's in the plan that seems to imply that increases in funding will only be available to R&Rs that serve low-income families. And we certainly agree that targeted services to low-income families are very important. When you're giving a referral to a parent, the amount of assistance that's needed to a parent that's of low income is significantly more. They have to find a provider who can accept the payments. They have to find a provider oftentimes who's near public transportation. If the county has no subsidies, they may have to find a provider with a scholarship program or a sliding fee scale. So we certainly think that that requires additional services, and no question that extra outreach is needed. But we don't want to undermine the fact that R&Rs need to be a community resource available to everyone, and also to underscore the fact that there are low-income families in every community across the state, and we'd really like to see this as a community resource available everywhere. In the area of staff to support oversight, monitoring, and enforcement, the Child Care Coordinating Council is very strongly in support of needing that kind of staff. We know what it's like to work when you don't have the staff to process the contracts, to move the bureaucracy. We absolutely agree with you. However, we encourage you, we really encourage you to look to the private sector wherever possible. We think given the hiring freeze, given the fact that the civil service system is already complex, we're all feeling very bitter about what happened in the licensing offices in Western New York recently as a result of civil service glitches. We feel very strongly that a lot of the work carried out can be done by contracts to the private sector, and we encourage you to do that, particularly if you're going to meet the timelines and really get this program up and running. And again, many other states have done very creative things in this regard, and we encourage you to look to that. The whole notion of voucher management agencies, the whole issue of CCRR agencies to recruit and train providers, intermediary agencies to administer startup funds. There are a lot of models out there. Data collection. Very little mention of data collection in the plan. Certainly mention of how they're going to report to the federal government about how they spend their money, and clearly that's important to the federal government. What's important to our agency and those of us who are working very, very hard to develop a system is to have the kind of data that we need to do planning, to understand what's going on in New York, to know what we need. And quite frankly, we don't have that data. And we think that New York needs to and has a unique opportunity right now to develop a data collection system that will go across systems. Look at the child care supply as a parent looks at it. A parent doesn't ask, give me the list of the programs that are regulated by the Department of Social Services. Give me the list of programs that are regulated by the State Education Department. They call up and they say, I want a child care program in this community. Tell me what exists. And the state ought to know what exists in each community, regardless of who funds it, regardless of who regulates it, divided by the length of day of the program, the age of the children that they serve, so that we can draw a map and say, this is what services look like in our state. Right now, we can't do that. We're not even close. And it's really essential that we begin to move in this direction. We're getting money that we can use for this resource, for this purpose. We need to begin looking in that direction. That's it. Thank you very much.
Thank you. I had a couple of questions, and I don't know if anyone else does. When you were talking about delays in payment to providers, I assume you were talking about retrospective budgeting, but I didn't know if you might have been going beyond that. You were talking about particularly jobs participants.
Are you talking about when I was saying to eliminate the cash reimbursement option? Or
Yes.
When, okay. Yes, right now, the cash reimbursement option, when I say they don't get their check for 2 months, it is related to retrospective budgeting. However, if you look further in your plan, you're saying that the counties get 45 days to pay people, and then they get it appears another 30 days to certify them for payment. That's even worse than 2 months. It adds up to 3.5 months.
And I just want to clarify, and other people may have questions too, on seamless funding, I think you were talking largely about establishing a common match for localities on federal and state dollars. Did you have anything else on seamless funding? Because, I mean, it's sort of a, okay.
Yes, you're right. I mean, that's obviously my biggest beef. But we think that seamless funding needs to be the same rules and regulations for programs across the board, the same rates, the same eligibility levels. Basically that when you go for a child care subsidy, you go for a child care subsidy regardless of whether that subsidy comes through Title 4A, Title 20, CCDBG, whatever the source. It's a consistent program.
Okay, thanks. Does anybody else?
Yeah, I have one question. You mentioned under, I think, the category of oversight and monitoring to look to the private sector. Are you suggesting that the private sector also take responsibility for actually monitoring the quality of services?
I'm saying that that is an option. I think that there are ways in which you can break down the job so that different portions of the job are done. Let me give you some examples. In some of the counties right now in western New York, they're working hand in hand with, in some cases, R&R agencies, in some cases, CAP agencies, where the local agency goes out and does a lot of work with the provider, helps them fill out the forms, does a technical assistant visit to walk through their home to get ready. And basically what happens is that the state, when this state person comes to inspect and to look at the forms, they're given a packet that's already been put together. They basically have to just approve it, stamp it, do the official visit, and it's done.
But that's where you draw the line. You wouldn't have the private sector individual actually doing the formal inspection for the state.
I'm not going to eliminate that as an option for someone who is willing to take on that liability risk. I think you'd have a hard time finding people who have the liability insurance that are willing to carry that, but I don't want to preclude that. I think that there are some agencies that are willing. Under the daycare development projects, we had agencies that did it, and we have agencies that are saying, I'll do it again. So I don't want to say that we would absolutely eliminate that. I think that there are some agencies that are willing to do it.
Okay, thank you.
One last question. In your comments about shifting the dollars that were proposed in the budget into training, were you proposing then reducing the amount in startup? I mean, I guess they're fixed dollars, and in fact, for those of you who aren't aware of it, federal rules may in fact prohibit or at least make difficult the meeting of the budget requirements. And we're looking at how to shift dollars around. So I guess the question is where would you take money from?
I'm not prepared at this moment to say take money from here, take money from there. I mean, if I were going to write your allocation plan, I'd be happy to sit down and tell you, gee, why don't you look at it this way?
Okay.
You can call me up, Judy, I'll be glad to do that. But I can't sit here right now and say, gee, I'm going to target that pot where you ought to take your money, or target that pot. I am not prepared to do that.
I wanted to ask a follow-up question on seamless funding. We used to call this continuity of eligibility, and we've been talking about it for a number of years. I remember some of the hearings under the Commission on Child Care where parents would talk about with all of these different child care funding streams and eligibility expiring under one, that they would get a letter terminating their eligibility from one child care funding stream with no indication that they could be eligible for another one and ought to come in and apply. Is it your impression that this same kind of treatment is happening around the state to parents?
It's much more complex than that, Charles. It's really that you've got different people administering different programs who don't know each other and don't talk to each other. I mean, you've got employment divisions administering one set of money, services division administering another set of money, income maintenance division administering another set of money, all saying different things. When I call the Department of Social Services, we just recently did our survey on reimbursement rates. I mean, the contortions I had to go through to find the right people to tell me the rates and then try to verify whether they were all saying the same thing. And I still am not, I mean, Judy pointed out to me that there are some errors in our report, and I said to her, my information came from the local districts. I mean, if the local districts don't know what they're doing, then I can only report what they tell me. But the bottom line is there are too many people, too many cooks, cooking too many different dinners in too many different kitchens, and it's crazy. If it's a daycare program, it should be in one place. And everybody who needs daycare should be referred to one place with one subsidy system, with one set of rules. I mean, you know, it's just crazy. And I can't believe that it isn't a waste of administrative money, that it isn't a waste of staff, that it isn't duplicating efforts. It just doesn't seem like the way to do business. Sure.
The next speaker is Joe McTighe. Is that how you say it?
That's it.
Okay. The Executive Secretary of the New York State Catholic Conference.
I was just telling people as I entered who were wondering how to pronounce my name also, that I'm
Oh.
a school principal in a Catholic school. And Catholic school youngsters are heavy into phonics, and so they would absolutely mutilate that name. They'd want to pronounce every single syllable, every single letter. So it was McTighe and McTighe, and forget about it. I'm Associate Director of the State Catholic Conference, which is the public policy arm of the Catholic Church in New York State, which itself is the largest private sector provider of elementary and secondary education, social services, health care in the state. We operate over 900 elementary and secondary schools, 45 hospitals, an extensive network of social service agencies, including child care centers, and collectively serve millions of New Yorkers annually. So on behalf of the church and all its affiliated agencies, I welcome the opportunity to testify today. I think Louise and I had the same speechwriter, because I too want to begin by commending the department, and particularly the Bureau of Child Care, Joanne, Christina, and company for absolutely completing what was a nearly impossible task of sorting through the regulations, putting together the plan, and all in an inconceivably tight time frame. So applause and sympathy and thanks for that. The Child Care and Development Block Grant was envisioned as a potentially revolutionary opportunity to rethink and radically reshape child care across the country. A key element of the legislation is the provision of child care certificates, which allow parents the maximum opportunity possible for placing their children with a provider of their choice. Unfortunately, and probably due to the extraordinary time constraints imposed on this project, The state plan in its current form is virtually silent on the issue of child care certificates, indicating merely that the Department of Social Services will have some sort of certificate payment system in place by October '92. We question whether the plan's bare-bones assertions regarding such a significant component of the block grant satisfies the application requirements, which seem to call for a more extensive description of the system. But regardless of the answer to that question, be assured that we are eager to work with the department, with parent representatives, with other advocacy groups, to design a certificate program that truly reflects the spirit and intent of the federal statute. And be further assured that we are eager to do so as quickly as possible, for we are concerned that advancing a full year through the grant program without the certificate component in place will so commit available funds and entrench standard spending patterns as to make it exceedingly difficult, if not impossible, to ever implement an effective certificate program. A major advantage of certificates is that they vastly and immediately expand the pool of child care providers available to parents. Armed with certificates, parents can consider a host of new opportunities for child care, including churches and church-related schools. In fact, the reality is that because such institutions are often conveniently located in urban neighborhoods and in locations close to major work sites, are trusted and respected by many parents, and have an excellent track record in educating and caring for children, they will surely be an obvious and welcome choice for parents. But it is only with certificates that parents will be able to make that choice. Accordingly, we urge the department to take full advantage of the creative opportunities afforded by the grant by ensuring that child care certificates are made available to parents as soon as possible. It is widely recognized that there exists a dire need for quality child care in this state. Certificates provide the opportunity to tap new resources to respond to that need. We have a few additional concerns related to this issue. There will need to be an extensive good faith effort to educate parents, providers, and social service districts about the requirements for the benefits of child care certificates. The federal block grant does not represent business as usual. Instead, it provides parents a host of new rights and opportunities. Somehow, the key players in the program need to know the standard ways of operating, and the usual state-to-provider funding streams are not necessarily the norm. We urge the department to see to it that the state plan incorporates adequate public information, parent education, and provider training, particularly with respect to the new elements of the program. We also urge that programs and contracts intended to train or assist providers ensure outreach to the numerous new providers envisioned by the grant. Finally, we encourage the department to establish a broad-based advisory group to make recommendations regarding the implementation of the state plan. The group should include parents, child care advocates, and providers, including the new types of providers encompassed by the block grant. The State Catholic Conference would welcome the opportunity to be represented on such an advisory committee and also stands ready to assist the department in whatever way it can to ensure that the block grant's dynamic potential to creatively expand the availability of quality child care in this state is fully realized. Thanks for the opportunity to make those comments.
Have opportunities to discuss with us the certificate program that we're struggling to envision. I mean, there are a number of models that we're looking at, and we certainly would appreciate your input. Does anybody have any question?
Getting off easy. Thank you.
Yeah, that's right. Thank you. Ronald Soloway, Director of State Policy for the United Jewish Appeal Federation.
Louise Stoney.
We made
She
sure you
always manages
didn't.
to say everything. And then beyond that, you put me after the Catholics.
It was considered.
Let me first say that some of us are old enough to have been in this fight for federal funding for 20 years. I don't know whether I enjoy saying that or not. And now, having thought that we won a victory, I understand the House of Representatives is playing games with the amount of money that's going to be available, and all the allocation plans that the legislature may have passed may be at risk. So I guess the fight is never over. And the one thing that I am very proud about is that we've all been able to work together over very, very many years, both on the panel and in the audience, to make this day happen. UJA, Federation of Jewish Philanthropies, represents about 130 human service agencies in the New York City metropolitan area, which includes Nassau, Suffolk, and Westchester County. About 20 of our agencies provide daycare services, and we provide services to about 3,000 young people during the course of any given year. As such, I don't know that we're as big a provider as the Catholics, but we're certainly a significant provider in the metropolitan area. Let me start out by saying, just picking up on what Joe McTighe said, that the voucher certificate program is of major concern to us too. It's of concern because we have numbers of poor children who we turn away from our programs because philanthropy cannot raise enough subsidy dollars to encompass them in our programs. I think a survey that I did about a year ago showed that we had about 300 to 350 youngsters who were on waiting lists who could not be accepted because subsidy money was not available. Many of their parents wanted to send them to our centers either because they thought they were quality because of Jewish communal interest. I should also mention, however, that only 60% of our population is Jewish. 40% are other denominations, other ethnicities. So we're not talking about wanting certificates only to serve a Jewish population. So it's very important to us that those parents have choice because they do qualify under 200% of the poverty level or whatever percentage may eventually get selected. So we would hope that in developing a certificate program, and we agree with Joe McTighe and the Catholic Conference on this, I mean, things were very vague in the plan, that you take into consideration the development of a plan that will truly provide parental access and access for the children. So that's issue number one that I'd like to bring up. You notice that I didn't start by telling you what a wonderful job you did. I hope you have my testimony with the first 3 paragraphs before I criticize. Get into that, but since 2 people have already complimented you, I don't want to spend valuable time doing it again, but there are some very good aspects in the plan. We were also concerned about the fact that in terms of the allocations, there was no data. I understand why that happened because you haven't been able to figure out how to move the money around yet in order to try and meet the guidelines set by the legislature. We have one concern, which is that we would like as much of the money to go to services. We do not deny the importance of a daycare registration system and having to ensure that that's a quality system. However, we would like to find as many ways to economize on the cost of that where it doesn't compromise quality through using nonprofit intermediary agencies or local government. I know that at one point we were talking about a system that would cost $12 million. I think now we're talking about a system that might cost $6 million. I'm not convinced that we couldn't bring that down to the neighborhood of $3 or $4 million and put the rest of that money into subsidy if we were creative. So we would like to work with you on that issue too, to find ways to make a daycare registration system work and be quality at least cost. Now, you can't argue with those goals. All we have to do is try and meet them. I would also like to agree with Louise Stoney relating to the 3 funding streams of the low-income daycare, the Title IV-A, and the CDBG funds. For our people, who apply, we want to be able to say, this is the eligibility criteria, this is how you get your money, to make it simple. We don't have the technical assistance to walk people through systems. We would like it to be one-stop shopping. And so I reference Louise's comments and hope that we can do some more over the next year in making that happen. One of my final comments relates to the fact that UJ Federation supports 200% of the federal poverty level as a good eligibility criteria in terms of using these, in fact, using all of the state and federal funds. We think that you should consider in some communities that are high cost giving some waivers, not appreciably above 200%, but we shouldn't set that in stone if the allocation of money to those communities can't be used because all the people up to that eligibility criteria, are being served. I don't know whether, in fact, that happens or not, but I know that some counties have claimed that it does, and I would hate to see that money moved elsewhere, where in some of those communities, particularly Nassau, Suffolk, and Westchester, where a number of our agencies operate, we know that the cost of living is particularly high. I guess those are the major comments that I'd like to make on the plan. As I said to begin, I'm pleased that we're all here talking about a plan finally, and I look forward to, is it September 7th, when a check will get mailed to the state, hopefully, and we'll be able to begin providing more services to more children in need. Thank you.
I just want to thank you and say that, again, we will be contacting you for your input, particularly on any creative solutions you have to the registration budget. The 12 million and the 6 million numbers that are being tossed around, by the way, include more than just the registration system as we know it, but were designed to include daycare center licensing as well, and to accommodate some of the additional expenses. So, and also included some additional expenses that show up elsewhere. I guess we're concerned that services may be defined very narrowly by the federal government to be exclusively subsidies and not consider other user needs in accessing child care.
Right. I guess one final concern I would just note is that in trying to meet the legislative standards for how to spend the money, I understand you're looking for creative ways to do that. I would be concerned to the extent that we use one-time funding, for instance, in order to put into place a state workforce that's going to do registration, or even, a voluntary sector, people to do that. Where next year we are faced with the crisis of not having the one-time funds and having to take it out of subsidies. So I would ask that you look at that and be careful.
The Division of Budget is looking at it quite carefully as we speak, I'm sure.
Fair enough.
Thank you for suggesting it. Did anybody else? I'm sorry. Diane Ballard, who is a child care provider from the Buffalo Coalition of Home Daycare Providers. And Diane, I don't have the name of the woman. Dee Cosby. Yeah, you'll be testifying also with Diane, right? Welcome.
Oh, excuse our briefcase here. We understand that this is being recorded, and on the way down here, my mother said, listen, I got $20. We can go downtown and buy you a briefcase. So I kind of lied to my mama. I told her, oh, no, Mom, for real. We just putting this in a bag because we got to pick one up on the way to Albany. So now that they got this video, gee, Mom, I'm sorry. I lied.
Hello, I'm happy you're able to come today. We were notified about this hearing. It was a real short notice. It kind of shocked me that the notice was so short. We pushed a couple panic buttons and got a lot of people on the telephone. We even had an emergency meeting of home daycare providers on Friday to discuss the public hearing. We are here to represent home daycare providers in Erie County. In reviewing the state plan, we're not all that polished, okay? Half of the information in here, I don't know what you're talking about. So what I will talk about is what I do know about, and that's home daycare. In dealing with home daycare, I'm finding some questionable items in the summary. At the very beginning, it talked about $12 million going to training in Erie County. And again, I'm going to say Erie County. When you hear me talk about what is and what is not being given in home daycare, I am specifically talking about Erie County. I'm not sure about other counties. So if other counties are doing much better than our county, I'm glad that somebody's doing something. We have home daycare providers who have been in existence from 5 to 6 years. We have been constantly struggling to keep our businesses open. We have been finding that home daycare providers that live in inner cities and in the poor communities in particular are the home daycare providers who are suffering the most. Many providers have opened up their businesses with the hopes of providing low-income child care to their communities because there have been a lot of information going out into the community talking about a desperate need for low-income daycare. Yet over the past 5 years, with home daycares cropping up, right now we have about 140 home daycares in Erie County. Of the 140, I can say that at least 125 are not full, have never been full. I have been open for 2 years. I have never, ever been full to capacity, and my daycare center is specifically designed for low-income children. I contacted the county, told them that the reason why I opened, well, maybe I should go into that. The reason why I opened my daycare was I had a sister who got divorced, ended up getting on welfare. After a while, we didn't grow up on the welfare. We are not part of the welfare system. We grew up in a family where my mother said, look, you work, and I don't care what you have to do, but you work. And so one of the things that when she got on welfare, the whole family kind of was like, surely you can find a job. I mean, that's lazy. The problem she ran into, though, was daycare. She had 2 daycare-aged children. She called her old caseworker. She said, look, my boss told me I have one more time to be late, one more time to be absent, because I do not have a reliable babysitter. Is there any way that you can help me pay for daycare? Her social worker, the social worker told her, no, your best bet would be to stop working, get back on welfare until your children become school age. With hearing that, my mother, and my sisters and brothers was outraged. Myself and my mother, who lived on the other side of town, decided at that point that we would open up a daycare in our homes specifically for low-income working women who wanted to stay off of the welfare roll. My mother, daycare was open for about a year. After watching me struggle from month to month to remain open, my mother closed it down and rented the apartment out. In 1989 to 1990, Erie County licensed 100 licensed daycare homes. 40 in that 1 year period went out of business. Erie County had graduate students do a survey to find out why these daycare homes closed in such a short period. Time and time again, there were 2 reasons. The first reason was that it was inadequate training. The second reason was that it was not enough income in order to keep their families afloat. The last time I was in Albany, as a matter of fact, this is our second time to Albany, we talked about many problems that home daycare faced in our county. At the time that we came to Albany, I told several people it was the first time in my life since I have been an adult out on my own. I'm calling myself self-employed. I'm doing a public service, providing daycare to low income, yet I qualify for the very services that most of my parents qualify. I qualify for food stamps, I qualify for heat benefits, etc. I have no medical insurance. If I get sick, I have a problem. When I came to Albany the last time, I had a shut-off notice on my gas bill. I had a decision to make. You either pay the gas bill or you catch that train to Albany and you talk to somebody to let them know. In the past, home daycare providers in particular are unable to come to Albany to go to a lot of the meetings that are held from 9 to 5, Monday through Friday. It is at that point when we are in our homes taking care of children. We cannot make many of these meetings. One thing me and Dee Dee laughed and talked about with the providers on Friday, it was like, wait a minute, once you get broke, you broke. So I tell you what you do. Let's pool in some dollars, get some gas in the car. If we have to spend the night in the car, we will, but we're going to be at that hearing. And that is one of the reasons why we are here, because providers got together and said, look, we need somebody to go, and I have nothing else to lose, to tell you the truth. We have a big problem with our CCR&R. Providers, we feel that before our local CCR&R get one more dollar, what we want is that there is a hearing and an investigation to see where the money has gone. They have been funded by the state for $180,000 last year, as well as the county for $20,000 in training. Some of the training that they give is very unrealistic, and I will give a quick example. One, marketing your business was a training. The trainer told us that the best way to market your business was to, when you see someone move into your neighborhood, to bake a batch of cookies, go and say, hi, my name is Diane Ballard, welcome to the neighborhood. I have a daycare. That sounds okay. If you believe in Ozzie and Harriet and believe in 1991, such a thing still exists. What we are dealing with, home daycares, are in the communities where oftentimes we have very high risk communities. We live in communities that have drive-by shootings. We live in communities that are infested with drugs. If you want to talk low income, then let's look at low income communities realistically. There's high unemployment. People who are going for training programs, it looks and sounds real good when we look at welfare reform and we say, oh gee, great, we get these people trained, they're going to get a job. Realistically, someone who does not have a college degree, if they get a quick training, a 6-month training, we had one parent, in fact, went through a training program for locksmith. That's fine and dandy. Let's start looking at some serious waste of funds. This woman went through a training for 6 months for locksmith. The training program did not secure any positions in that particular field for women and minority women in particular. After that training was completed, she found herself more depressed than she was the very first day she went. She is still on the welfare rolls. 6 months of daycare payments was made. We think that that's a waste of money. We think it's a waste of time. And we think that it's really playing with people's lives when this woman truly believed that her going through this training, she was going to be able to earn enough money to support her family and get off of welfare. When we deal with a lot of low-income working women. They are making $4.25 an hour. At the current rate, unless of course we start to work out make some serious plans with daycare incentives, not for 1 year. When I worked at the bank, the maximum in pay increase you was going to get was 6%, and you better be excellent all the way across the board. So when we start looking at transitional daycare, and there's assistance for 1 year or 2 years, I'm saying it's impractical, it is unrealistic, and the only thing that we're doing is further entrenching women into poverty. The same thing with home daycare providers that service inner city communities and that service low-income communities and the rural communities. If that community is predominantly low income, then that provider will be low income. I have yet to have a doctor or a lawyer or someone who can afford to pay me $100 a week to stop by my daycare and say, hey, will you take care of my children? What I have is I have 4 currently drug-exposed children in my daycare. I have 3 children in foster care program. I have children who have some serious problems, and they take us into training. When I opened a daycare, I was idealistic. I thought that I could open up a daycare and take care of these children and do such a great job like I did with my own daughter. I found out that is not the case. What we are looking at not only children that are high risk, that have a lot of emotional problems, many of them have speech problems, many of them have all kinds of problems. Not only are the children faced with problems, but so are the parents. We are doing informal case management. We are sometimes feeding the parent as well as the child. We are trying to serve as advisors to try and help them out of different life situations that they're in. We're teaching them how not to beat the kids to death. You know, we are doing all of these different things that is not noted on home daycare providers. And when I hear the term that we don't need training, I'm saying yes, we do. We need training desperately. Not only do we need training when we talk about just early childhood development, we need training to just deal with everyday life problems that the parents that we serve are dealing with. And we also need to take a look at who needs to do the training. RCC R&R is made up of a group of women who are very polished, who come from the business world, who look like social workers. And the bottom line in our communities and poor communities who have came through that welfare system, when we look at social workers, we do not see social workers as that person that really want to help us. We see that social worker as somebody coming to take our kids. And it's just that simple. When we take a look at our CCR&R, and who is now the pre-licensing agency, what we see is someone who's looking to see if we are making a mistake to take our daycare license, to take our livelihood. We are dealing with people who are insensitive to our needs. Even in talking to them, they have absolutely no idea of some of the problems that we face on a day-to-day basis. We need training that it is a non-threatening It's in a non-threatening environment that is conducive to learning. We need home daycare providers to be able to get together to talk about problems such as abuse. When we talk about child abuse, oftentimes providers themselves may have been victims of child abuse. When we talk about wife abuse, oftentimes the providers themselves have been those victims. To give you an example, we had a provider who called me in the middle of the night and told me that there was a 4-year-old that had been sexually abused by the brother and asked me what should she do. The first thing I told her was, did you call Child Protective Services? No. Wait a minute, that's one of the things we have to do. We must report it. She said, I can't. To make a long story short, the next day I called, she still had not called. I called downtown and I said, what is my responsibilities? Am I responsible for calling if the provider decides not to? I was told yes. I called her back and I said, do not put me in that position. I need to call. You know, if you don't call, I will have to. At that point, she started crying and she told me, she says, Diane, the reason why I can't call is that I was also molested as a child, but it is not Child Protective Services that I fear more than anything else. I fear the foster care program. Not only was I molested from my stepfather, but when I went into foster care, I was also molested by the brother and the father of one foster care home. They taken me out of that home, put me in another one, then I was beaten. She said, and I do not believe that any child should be taken away from the mother, because at least when I was at home, I felt some form of security. You know, and once my mother found out, my mother was willing to take me everywhere with her, and they took that security. We need to set up some kind of support systems for providers when they run into this situation. She told me it had been more than 20 years since she thought about that. Now we're looking at the crisis, not only with the child, but the crisis was also with the provider. And when we are in a crisis state, we also have problems dealing with certain situations because of our own true feelings. We need to put in mechanisms that will bring up these feelings long before it happened. We need to do training workshops that will help us to be able to deal with our own personal problems. We are talking about using welfare reform as a way of providing maybe more child care slots. Erie County in particular have been recruiting people who was on welfare in order to open up home daycares and to use daycare as an alternative. These are many of these people who are being recruited. There is no training, no preparation at all. We're told what the state licensing are, how do we get licensed. Once we get our license, then we're thrown out there, okay? And we have nothing to fall back on. When I first opened up my daycare, I would go to Rochester for training. I have came as far as Albany for training, looking for information. I have gone back and forth to our local CCR&R only to feel intimidated and to feel as though I am the problem. I am alienated. Oftentimes the staff do not speak to us. In a recent luncheon, the Senator Task Force 2000 came to visit 2 home daycares, okay, along with a couple other daycare centers in the area. Senator Massiella's office sent us a note saying that the Child Care Coalition, which is our CCR&R, was having a luncheon. Our CCR&R invited different daycare centers. They also invited directors, but they did not invite home daycare providers to this luncheon. We went anyway. There was 2 people, myself and Gretchen Cormier, who is also the chairperson of the Family Daycare Association. Neither one of us was spoken to by either Judy DePasquale or her staff or any of her board of directors members. We find that to be disgraceful. We have had several confrontations with her, and we have been constantly trying to work with her to let her know what our problems is, if she have any problems, and we will give you the same, we will make the same statement to you. If there is...
I appreciate hearing some of the relationships and some of the things CCRRs can do to help you. And there's staff here, Christina Hay. Can you raise your hand, Chris? Are you around? Well, there, Bob Crowley in the back. Can you, somebody who can talk to you about your specific problems related to the Erie County CCR&R, but time is limited, and I want to make sure that we look at the block grant and how we can use that most appropriately.
Okay, one of the things we do understand that, time is a factor here. But because our needs has not, this is the first time that we've had a forum to even say we being dogged in Erie County.
We really appreciate hearing from you.
So what we'll do here briefly is that one of the things is that when we read the first page of the draft, it talked about since 1984, that $12 million had been spent in child care funds in New York State. We're here to say that we're home daycare providers from Erie County. We are the indigenous population, and some of us have been doing daycare for 6 years, and we have not gotten $1 to buy one Lego block. So I'm having a problem with what we see in there. We're saying it's not true. And one of the things that we'd like to ask at this hearing is that before Erie County receives $1 in the federal block grant money to be targeted to home daycare providers in Erie County, we would like an investigation into how past monies have been spent. And that's just that's one thing we'd like. Another thing we'd like to do is that for too long others have spoken for us. We'd like to begin speaking for ourselves. We'd like input into the legislation and the policies which affect our lives. Governor Cuomo made whatever it is, a proclamation, a statement, or whatever it's technically called, saying this is the decade of the child. In Erie County, we're beginning to wonder whose child, because certainly it is not ours. We're here to ask you today to point us in the right directions. Tell us what we'd like to do. We'd like to start an alternative CCR&R so that we can begin to address our own needs. We have identified them. We know what they are. We're the population that the funding and the statistics are being written on. We're the one doing daycare. I've got an 8th grade education. I've never voted a day in my life, but that does not mean that my kids don't matter. And so what we're asking is that you help us, help ourselves. We've got the answers. We got a 4-page thing that we submitted to, hey, because we didn't even know what this thing is or how it going, and we apologize for that, But one of the things, and this is the last thing that I'd like to say, and then I'll unask the microphone. But we've been doing daycare, and this is probably the most key things, because I think unwittingly we all do things that are discriminatory. And the first thing to help us as women out of this poverty level is that we must get rid of that three-tier payment system that is being, the fair market thing, yeah, that thing. What we think is that it's discriminatory. If, in fact, the state of New York and Erie County is buying daycare, a daycare service, then a daycare service is a daycare service, whether we're buying it in the ghettos of Buffalo, New York, or whether that daycare is being bought in a suburb daycare center in Erie County. If you're buying a daycare service, it's a daycare service. And I think unwittingly, when people put forth that fair market value payment thing, it may be fair to some people, but to me it ain't. Because when we look at the county payments, most of those are in my community, you know, and we're the community that's in need of the highest payment rate. And it's like what Diane said, we're the ones in need of trainings, and it's trainings that the current CCR&R cannot provide for us because they don't know nothing about civil defense. You know, and we need courses on civil defense. And in civil defense, you know, what we mean by that is the state say we gotta take the kids outside, in which we do. And one woman had the kids outside and doing the, you know, the stuff with the kids. And next door, drive-by shooting began occurring. You know, well, fortunately, because it's our community, you know, because she was aware of the community she lived in, she was able to get the kids down and lay her body across it. But that's the kind of civil defense we need. And the people that you're funding now for our lives don't know nothing about us. We know about ourselves. Don't do any outreach to us. Give us money and we will reach out to ourselves. Diane, I think you did real good. Oh, and I know everybody else praised y'all on how well y'all did on this thing. But I told Christina, hey, when we came in, I asked her, I said, why are you people so damn nice? We come in and you speak and it's high, and hey, I was wanting to meet you. And I want you guys to know that we really appreciate that, because in that you have validated our existence, you know, and that's what we're kind of hoping that we can get from here now.
And I think you've reminded us of ours. Thank you very much. You haven't heard the last of us. I want you to see either Bob Frowley or Christina Hay to talk about some of the specifics, and we would be glad to look into some of the concerns that you raised. And I think you've underscored for us a number of the issues related to training that we just need to look at very carefully as we move forward with registration and all the requirements for training, and look at how to make it relevant. I'm sure we'll be calling you.
Good. That was going to be one of my suggestions, was that we have offered our assistance to anybody that's willing to accept it. There are several points of training, different things about training the indigenous population that we are all too familiar with. But when you talk about training, the training must be realistic. It must be something that people can identify with and work with. If you're giving unrealistic training, then what you're going to have is people will continue offering trainings and providers will not attend.
And we asked you, and I swear for God, cross my heart, hope to die, I shut up. I'm hoping that you guys are really, really serious, is because we've been organized only 2 months. We've got a membership of only about 48 people now. We have done some training ourselves. We've certified 25 to 30 home daycare providers in infant and toddler CPR. It only cost them $7, you know, but we're able to get people to do stuff for us. And it's that, our efforts to do stuff like that, that's giving us hope. Because what we're hearing from some of the old dogs that's been out here, you know, and used to this stuff, they tell us, say, look, Diane and Dee Dee, the only way you're going to get the state of New York like to listen to y'all, I got some attorney names, bring an injunction against the injunction or something, and the terms I miss, stop the federal spending of the monies and crazy stuff like that. But that's not what we want to do. We think that it's better to meet at a table of negotiation than it is a table of confrontation. We really don't think that just because you guys work for the state, that y'all bad people and that y'all really don't give a shit. Oh, I'm wrong? But we're going to give up the microphone, and I really appreciate y'all talking, listening with it.
We appreciate. Oh, okay.
One more comment, and that's on we do not want to see the certification process or the regulations eased. We do not want that to be eased. What we really and truly need is we need the certification and the licensing process to be very rigid. It does a couple of things. One is that with rigid policies, okay, it makes we are working very hard to say, look, we're not babysitters. Babysitters are 15. We are adult women, men and women who are taking care of child care. And in order to provide quality child care, we need the education. We need to make child care a profession. And if you ease up on the requirements for it, then you are saying that, oh, well, they are babysitters and they do not need special training. They do not need to the professional status. All professional statuses, there is a certain amount of sweat you have to go through. And if child care is truly our biggest concern, then we want to make sure that each and every individual that is doing child care is educated and that they have the expertise that they need to really and truly provide real child care to our communities. Thank you.
Yeah, I'd just like to note that you were the only two who came from out of town, and you came from all the way from Buffalo, and I recognize that it was probably a hardship for you to do that, and I can't tell you how much we do appreciate your being here, and I do want to assure you that you have been heard. Thank you again.
And that you found out about us is really quite amazing, given the way we release these notices. How did you hear about the hearing?
Well, I read... information is a big problem in our area. We don't get a lot of information. I read it in a magazine back in January. Family Day Caring magazine talked about the federal block grant and that you should call your the state registration office or the Family Day Care Association. At that point, nobody really knew what I was talking about, and I continued. So finally, Carolyn Hoffman sent me the information on Thursday, and I continued calling her. Did you hear anything about the hearing? Did you hear anything? So we knew it was coming up. We just didn't know exactly when. And we were, we made a lot of calls. We had people up on Sundays. It's like we had to be here. So we are glad we were able to come.
Thank you.
Follow-up question. You at the beginning of your remarks, you referred to a 40% turnover rate amongst family daycare providers in the county, and the main reasons for this were that many of your homes have vacancies, and so you're not making enough income. Earlier this afternoon, several people talked about this new proposed certificate program where any family that's eligible for some subsidy money would get a certificate for the value of whatever subsidy they're eligible for, and they could go out and select whatever provider they wanted to use and give them that certificate, which is good for cash. Do you think that kind of a system would help in your community and with the providers that you represent?
It would not help in our community, and I'll tell you why. And I'm going to say mine, because right now I'm representing all of the home daycare providers in Erie County. We do have some communities where I think it would help. In inner city communities and communities with high crime, with serious problems, to tell you the truth, I asked one of the local social workers who did, she was the supervisor over our county daycare unit, to find out why we was not full. At first I thought it was the social workers was not talking about home daycare as an alternative. So she told me, she said, Diane, you're not gonna believe this. She said, but when we talk to the clients, the resistance is not coming from us, it's coming from the clients. the more I thought about it, I said, you know, I would not put my daughter in the community across town either, because I don't feel like ducking bullets trying to get over there. We all want to put our children in safe environments. And if you have home daycares that is in a community that has a lot of problems, nobody in their right mind will actually venture from this side of town into that community. So what we're saying, and we can't just get people and make them move outside of the community, but what we need to do is we need to start networking with local community groups within that community and say, okay, you have a drug program, can you send, you know, these people over here? I mean, the people are there. It's not like they're not there. Another problem that we face is that because of, and I think, well, it was mentioned earlier, and that's the fragmentation, where nobody knows who's doing what, and all these different places is making referrals, okay? What we find a lot of times is kiosk program, for instance, is making referrals to this group of people. We found that our daycare centers and the statistics, the numbers that I'm seeing here, I'm wondering if that's where they came from. And that was daycare centers are over full. They do have long waiting lists, but they do not refer those people to us with these long waiting lists. We need to start networking with daycare centers as well as community agencies as well as businesses to try and start to fill these slots. We do not just have all welfare recipients in our communities. We have working people in our communities. We need to do some serious public education to let people know, although you do live in a community that have many ills, once your child is inside our homes, they are in a very safe home, they are in an environment that is conducive to learning, that we are trained well enough to provide all of the necessities that this child needs. What we need is we need to do some serious mass education, which is one of the things we did in June. We passed out over 8,000 flyers talking about home daycare and setting up our own referral service. I think what we also need is that we need some kind of a subsidy or some kind of a program to set up for those providers who are having problems getting full, where they may be able to offer because chances are if they're really having serious problems, they're providing at-risk care. I noticed in here that it talked about the high cost of at-risk care. Right now, we're getting paid $45 a week or $60 a week to take care of children with learning disabilities, handicapped children. We get $45 if you do not have insurance and $60 a week if you do.
Do those children get any kind of support services provided at the home through the local special education programs? Is any of that going on that you know of?
No. We've been in contact with our language development program. I have 2 children right now that's going through that program, and what we need to do is link up with them. Then that way, whatever they're working with them, we can also work with at the daycare. But right now, one of the supports that we are getting, thank you, Didi, I forgot, was we did link up with Dr. Hoot at UB, at the University of Buffalo. I called him in desperation and said, wait a minute, I'm reading some things about children born addicted to drugs, and the information that I'm reading is just not true. These children learn, these children do this, that, and the other. So we have set up he has sent an intern to my daycare to watch these children. We will be working on the research aspect as far as drug abuse, drug-exposed children. He's also setting up an internship program for home daycare providers as added training for us, as well as for the interns to introduce them to certain communities. We're working with 24 other colleges through the Council of Colleges with Clea T. Massey at Holton College, who is setting up a CDA program, infant and toddler CDA program for home daycare providers.
And the emphasis on that being on special needs. kids.
Special needs children. We have found the need that, since these are some of the things that we are looking at and we're considering saying this is our needs, and we are trying desperately hard to get some of these needs met. And what we are asking for is whatever assistance that we could possibly get.
Have you had any contact or relationship with the Buffalo schools? Because we're interested in doing some collaboration with home daycare programs.
Yeah, see what happened with the Buffalo School, and I guess this is something that we should tell you guys. On April 27th, we had our first technical assistant conference at Burger King downtown, and we had like 65 people turn out from that. And so because that was so late in the school year, and that's when we really organized, we didn't really have a chance to develop a network with the school system. But what we did do is that we went to the NEC conference that was downtown at the Hyatt Hotel, and we've got people from NEC, is the New York State, it's the emotionally disturbed, for emotionally disturbed kids, because we had a kid, in our daycare that was like that. We had 2 that was like that. And so, we hooked up with NEC, and we're just now, we've gotten so much support, and I guess that's the thing that is really tripping us out and encouraging us, is that people from NEC, these people work with emotionally disturbed kids. We told them what our problems was. We said, these is the kids we see. Any kind of way you want to look at them, we see them before the Buffalo school system do. We take them at 8 weeks. Centers typically don't take a kid until they can go to the toilet by themselves, and they like 15 months old or something like that, but they much older. So we take them at 8 weeks. So we told them what our problems was. We talked about one infant we had that was like 8 months old, and they were real nice, because we say something wrong with this baby. I don't know what it is, and it's just the baby wasn't right. Well, they helped us define it, and fortunately we were able to get the kid and the mother, in a program, and we got letters and stuff. That's what my briefcase here is all I have here in my briefcase. But we have reached out if that's a part of the public school system, but it's the NEC people. But that's because, again, we organize because of what we seeing specifically in our daycare, and we really do need some help.
We did recently contact the city of Buffalo to discuss. We were having serious problems with transportation from the Buffalo school system, with having children dropped off 2 blocks away. And we tried to explain to them that because we do home daycare, the choice is, do you leave 6 children in the house to go 2 blocks down the street to get 1?
Yeah.
And so we was assured that they would start looking at the transportation to have the bus service drop off in front of the house, as opposed to we was at a point where we had to turn down people in the community that needed daycare, but their children were being bused because we had no way of picking the child up. So we do want to work with the Buffalo school system.
We have to. We ain't got no choice. I mean, we got to, with Head Start. Head Start is,
with Head Start,
yeah, excellent program.
One of the things that we did notice with Head Start is that Head Start is going to, a lot of us, the eligible children that will go into Head Start at 2.5 years old is the children that we work with now. If we're already not full, what's going to happen when Head Start taking these children at 2.5? What we'd like to do is start working with Head Start to work out a program to provide before and after school care, summer, the breaks, and the summer. This way, many of these Head Start kids also come from foster care, whatever. It will give them a stable environment if we can connect with Head Start and work on some kind of program. So if anybody know anybody in Head Start, please tell them to call us.
I think one of the things that you're underscoring is that childcare can't be separated into little blocks, and unfortunately we're here about a fairly contained small plan, and you're talking about a lot of other things that we're all looking at and interested in. I'm sure that we'll want to be following up with you on some of those issues fairly soon. And again, thank you from all of us.
And you guys up there, we're sorry about taking up so much time, but Excuse me, Mr. Brown there, can you add another hour to the day? Thanks, y'all.
Hopefully the next time will be much more refined.
And we'll be taking that. You were fine.
Diane Meckler, who's the Executive Director from the Capital District Child Care Coordinating Council. Diane. Thank you. We'll pass things.
Good afternoon. They say in life that timing is everything, and I have a feeling I'm in the wrong place at the wrong time. You're a tough act to follow, ladies, especially as I'm representing a local child care resource and referral agency. I feel like I want to spend the next few minutes justifying our existence and telling the people in the audience and telling you the fact that we have been able to succeed as a child care council and feel that our work has been commended in the community and we've been a great asset to child care providers. In 1989, our council did receive $135,000 in funding to serve a four-county area, Albany, Rensselaer, Schenectady, and Saratoga, with a total population of 780,000 people, including 64,000 children under the age of 6. And as Louise mentioned, according to the spend-down formula, our council is now entering its third year of operation. And through the hard work of a dedicated staff and a surprisingly positive corporate economic climate, our council has been able to survive the financial crunch imposed by the spend-down formula. However, we are now faced with the impossible task of trying to provide the same quality level of service in year 3 as we were able to do in year 1. And during the first year, our council provided resource and referral services for 1,902 parents in need of child care and conducted 30 training sessions for 945 child care center staff members. I've eliminated the training that we've done for family daycare providers because in essence that has been funded through corporate dollars and is not really covered under the CCR&R money. Now we're struggling to provide educational training for 155 centers and resource and referral services for 750,000 people in our four-county area with only $67,000 in funding, which translates into the work of 2.5 staff members. And as part of our mission, we've really tried to address the child care needs of all people. We do provide an enhanced level of service to those of low income, serving as their advocates and navigating through the complex system of low-income daycare funding, transitional child care, and job subsidies. And on a shoestring budget, we've recently conducted a series of workshops on integrating special needs children into the child care setting as a means of addressing a type of child care which is in short supply but great demand. And I'm here today to request that the distribution of funding for existing child care resource and referral agencies be made more equitable in terms of population and community needs and be raised at least to the 100% level of year 1. And on behalf of our area child care centers, I would also like to take this opportunity to request that the concept of salary enhancement grants be reconsidered and included in this child care and development block grant funding, thus enabling centers to raise salary levels to begin to be competitive with the teaching profession rather than the fast food industry. And thank you for the time. Any questions? Thank you.
Linda Jones, who's director of the Carver Day Care Center in Schenectady.
I'd like to introduce Jean Todd, who's the chairperson of the Carver Board of Directors. In Schenectady County, our small daycare center serves 50 low-income children whose parents are employed or full-time students. We've been in operation for 20 years. We serve children ages 1.5 to 10 years old in our toddler, preschool, and school-age programs. Although we've had a waiting list for almost 5 years, recently our centers had vacancies. We are experiencing some very grave financial problems, and because of several issues, our center may be forced to close. We have been providing many services over all of those years. However, in the last year, we've only been getting $70 a week for toddler care, $65 a week for preschool, and $50 a week for school age. If our center were receiving the reimbursement up to the cost of care to the market rate, which was proposed in your child care development block grant, we would not be under such financial restraints. The difference in our budget would be in the neighborhood of $1,400 a week. In April of 1999, we lost all transportation services to our children because we were not able to keep up with the expense. This created a loss of 20% of our population, especially the school-age children who we've served for those last 20 years. Children who attend area schools in in the Schenectady City District have been dispersed throughout the city through the magnet school concept, and as a result of that, we have some neighborhood children who have had to been relocated to other schools. And when we lost transportation, we not only lost our ability to serve the closest neighborhood schools, but we've lost our ability to really keep our school-age programs full. We've always provided transportation, and this is the first time in 20 years that we've been without this service to our children and families. Our daycare center has only been able to purchase consumable supplies recently. We're having all we can do with our food bills. We're buying diapers a case at a time, and it's been difficult to pay those bills. Our laundry materials, which things have to be laundered once a week, we've been having difficulty meeting those expenses. Our parent organization, Carver Community Center, owes huge sums of money for utilities, and Jean can certainly speak to that. Our center cannot pay for its share of administrative and cost overheads that are needed to keep the Carver Community Center out of debt. Our staff typically earn $4.25 an hour. Minimum wage increases went up, and we immediately had to find the money from somewhere, and we couldn't find it. It didn't exist. We're trying to hire teachers at $6 an hour, and I've had 2 teachers in the last 3 months who both have resigned because they've got jobs paying, not necessarily in the teaching field, more money. We've had only 1 salary increase, and that was through salary enhancement 2 years ago. And for instance, we have 4 staff members who've been there for 5 years or more, and we've all had just 1 salary increase. No cost of living increases have been included as well. We are victims of a faulty system, and the daycare centers have been exploited, and our counties cannot increase the rates because of the added costs of the local governments. Our local commissioner, we've met with him, and he said there just is no money. He's really concerned about what can happen to us. The market rates could improve the situation. We might be able to provide more than just on-site training for our staff. We haven't had formal training in our daycare center for 10 years. Our local CCR&R has provided annual training and referral for us. However, it has not been enough to maintain staff and upgrade the quality when those staff members have to give up their free time for in-service training and planning. Our county needs a unified subsidy system that will ensure funding for the families and the providers. We have stories from the parents who have given up and decided not to take jobs because they cannot access the daycare services in our county. Eligibility for several parents has been a nightmare. One parent wanted to go to work. She would earn $170 a week at $4.25 an hour, and she needed $270 a week just for daycare to pay upfront to us to get services for her 3 children. Although her children were all over 3 years old, she decided not to take the job that she was offered, and she decided to stay home on welfare. Another parent found a friend to take care of her child until she received her first check, and then she went ahead and applied as a low-income parent, and she was given a fee, and then she got the services, but she had to provide services through unlicensed child care until she could get her first paycheck. Several parents tell us of being sent from one worker to another in separate buildings and getting so upset and frustrated that they just decide to give up. Our county needs direction and needs to get technical assistance so that services can be given to any of the parents who need daycare. Our county also has indicated that it cannot afford any increases in its match for any level of added dollars for daycare. Our center is truly a victim in the cycle. We need slots in our county, the children need quality daycare, and we need the support of all the segments of our government to keep our centers alive. For these reasons, we strongly urge the New York State Department of Social Services to do the following: to merge the state and federal subsidy funds to create a simplified, unified subsidy system that will ensure seamless funding for families as well as the streamlined procedures for providers and districts, to eliminate the payment option of cash reimbursement to the parent to cover the cost of child care in favor of either cash advances or two-party check reimbursement system, which we used to have back in the early 70s. I remember it well. To increase the current $3.8 million allocation for provider training to $5 million for family daycare training, and an additional $2 million to begin new training and scholarship programs for staff in child care centers and Head Start programs. We would like to commend the New York State Department of Social Services for including in its Child Care Development Block Grant draft state plan the requirement the centers receive reimbursements for its actual cost of care, so long as it does not exceed the local market rate. This reimbursement would work to ensure that our doors will stay open to serve the many low-income families in need of child care services in our community. Without this additional funding and support for our center, we are in real danger of losing our service that has benefited the Schenectady community for 2 generations. And then attached to our testimony, we attached the market rate survey for Schenectady County as well as the proposed budget for 1999 that was not funded. Any questions?
Anybody have any questions?
Linda, the figures you gave at the beginning, the current rates you are now receiving for subsidized care from the county, I'm assuming that there's a fairly large difference between those and the market rate. Did you say that
Yes.
would add $1,400 per week to
Yeah,
your,
when I first did that,
your
I couldn't
income?
believe it. What I did was that I just in round figures took full enrollment at the market rate, and then added up what that would be in the 3 program components. And then I took what we're presently receiving, and then subtracted that. So I'm sure that that's not a real firm figure, but it's certainly a ballpark figure, that's the real difference between what it is that we need. And you can probably see as well that in the proposal, in the budget proposal, we're still only proposing to pay some of our employees $5 an hour. So we're only going from $4.25 to $5 an hour. But that's what the market rate could do for us. And it would certainly help Carver Community Center and its overall operation in the building. We're dangerously close to shutting down.
I guess I'd like to ask you the same question I asked the folks from Buffalo, since you also serve a very low-income inner-city area. There's been discussion about a certificate program that would, any family once eligible would put an amount of money in a certificate into their hands, and they could then go out and choose any child care provider they chose.
Right.
Do you think that would help Carver if your center situation, if that system
I don't know
were in
whether it would
place?
help. I don't know if it would help Carver specifically. I think it would help the daycare field. I'm a little bit concerned, as Diane was from Buffalo, that the provision of child care has to be, I'm in favor, obviously, of licensing and standards and quality, and I'm a little bit concerned about that. On the other hand, if the certificate didn't afford us any more than just $70 a week for toddler care, so what help is it going to be? We're still in the same boat that we've always been in. We're not receiving the cost of care, and we don't have the money. We can't, there's so many ways you can split the dollar bill. It's just that we're splitting it too finely. We're at the end of our rope. Okay?
Thank you.
Okay. Thank you.
Yeah, I caught that. Bonnie Fucci, I hope I said that right, Director of Sunshine Daycare Center in Rensselaer County. Oh, from the Rensselaer County Directors Association, and she's joined by Dolores Schrader, Director of Happy Kids Daycare. I assume also in Rensselaer County? Okay.
She's got a better speaking voice.
Good afternoon. Thank you for allowing us to present. I just have a brief statement that was compiled by the Rensselaer County Directors Association, encouraging the panel to reinstate salary enhancement as part of the block grant. The Rensselaer County Directors Association is heartened that the federal government is responding to the need for quality, affordable child care, as well as working to increase the availability of care to families of all incomes. The provision of funds to compensate centers adequately for participants in various federal job training programs is indeed an important and much-needed service. All families should have access to quality child care of their choice. We are disappointed the New York State Department of Social Services has not planned to utilize any of the available federal funding for salary enhancement. As center administrators, we see every day the direct relationship between a trained and experienced staff and the quality of care offered to the children. Children benefit immeasurably when cared for by staff with education and experimental knowledge of early childhood development. As managers, we have found that retaining and recruiting qualified staff is one of the most important means of achieving a quality program. Adequate salaries and benefits are vital to realizing this goal. Any amount of additional compensation is greatly appreciated by the staff and leads to an increased sense of esteem. Child care staff needs to understand that they are valued. One very concrete way of demonstrating this is by providing them with increased compensation for the important job that they do in the program. We urge you to reconsider the state plan for expenditure of the Child Care and Development Block Grant funds and designate funds for salary enhancement. Qualified staff means quality care.
Does anybody have any?
Oh, I would like to add also that the whole entire staff wanted me to close the daycare so that they could come to and let you know how they felt. My staff at my daycare center did request that we close the daycare so that they could come here and let you know that they really feel that way also. I know it's hard to just have directors come and say that, but I think that the staff really feels that way very strongly.
Any proportionment of the grant that could be put into salary enhancement would really benefit not only our centers in Rensselaer County, but centers throughout the state.
Thank you. There are several speakers who were not on the schedule. For those of you who have the list of scheduled speakers, there are 3 that have been added, and I think I'll take them just in order. Mrs. Dan Potter, who's from the Capital District Association of Rental Property Owners.
Thank you. My husband was here waiting to speak, but he had another speaking time, so I said I would come.
Oh, okay.
Appreciate you having me speak. We were the Capital District Association of Rental Properties. We are 4 counties. We're just not Albany. We're Rensselaer, Schenectady, and Saratoga County, so Saratoga Springs area.
You're going to need to talk into a mic because it's hard. Yeah, okay, terrific, thanks.
Thank you, excuse me. In general, the Capital District Association of Rental Property supports the New York State's draft plan for the use of the Federal Child Care and Development Block Grant funds. Among several concerns, we would like to voice a particular concern for the home environment of all children, and especially those who are clients of the child care services. We assume attention is given to this concern under the Training for Providers and Public Awareness and Parent Education Campaign. I cite the following from the draft. Section 3, Paragraph 2, description of activities to improve the availability and quality of child care. Number 2, for training for providers. Curriculum has previously been developed and includes training in health and safety, nutrition, principles of early childhood development, prevention of child abuse and maltreatment, age-appropriate programming for children, and business record-keeping and management. We assume this curriculum addresses the need for providers to guide parents or guardians in the importance of keeping their homes clean, orderly, and neat. The home living environment contributes enormously to the child's quality of life. Number 3, public awareness and parent education campaign. Quote, a comprehensive statewide public awareness and parent education campaign, unquote. It appears that this campaign is primarily to promote child care programs. Would it be possible to include in that campaign information and encouragement for parents or guardians to provide clean, orderly, and healthy households? In other words, to emphasize the importance of an attractive home environment as a valuable contributor to the quality of life of every child is an important concept that continually needs emphasis. As rental property owners, we are aware of the home conditions as of many parents whose housekeeping habits establish a strong negative influence on their children. Any child care program that deals with this would make a positive contribution to the quality of life for these children. Signed, Dan and Potter. Respectfully submitted, Janice Potter.
Thank you. Does anybody have any questions?
Mrs. Potter, have you handed in written testimony?
Yes.
Okay.
It's upstairs, yes. And we rent on, I'd like to say that I rent personally on Clinton Avenue only, so I am dealing with the affordable and the underprivileged children. So I know from experience and going in and cleaning and seeing if with a cleaner house you have less roaches and infestations and problems. And the children that do come from the cleaner houses, that we do rent to people with cleaner houses as well, they are much better children. And you can see it when they're going out in the street and things. And I thank you for your time and for the opportunity for speaking.
And thank you for coming to speak today. Victor Batorsky, who's the council leader of Division 34 Public Employees Federation. What? 234. 234? Oh, 234. I got, sorry, Victor.
Yes, thank you. Let me first explain what context that I'm here. I am here as the council leader of the largest single site local of the Public Employees Federation, representing over 1,500 state employees in the Capital District that work for DSS. My constituents have asked me to come here to pose a rather straightforward question. Any comment I might have would be a short one, but depends pretty much on the answer I get. State employees, we are curious to know how is the grant to be used with respect to hiring, promotion, or retention of state DSS personnel? And I don't know if you can speak to that or not.
I think what we're doing today is taking comments, and we'll certainly, if you have recommendations to make in that regard, we're perfectly willing to look at them.
All right. Then I'll make a very brief remark for your consideration. Based on our experience from the use of federal funds to pay for promotions and upgrading of administrative staff, there is a concern among state employees regarding how the administrative portion of the funding for the Child Care and Development Block Grant of 1990 will be used. There is, we feel, a more than sufficient number of managerial staff already working within the Bureau, including recent additions from Council on Children and Family. We feel that either additional line staff should be made available to implement the program, or the money should be put into local program implementation for which the funding is to be used. Our concerns about the uses of the fund for excessive administrative positions for what we feel are improper, possibly illegal hiring practices is available upon request, and if you want it, I can provide it within the next 24 hours. And that's our principal concern here.
Any questions? Thank you. And the last speaker that I have listed is Harriet Alger from the SUNY Campus Child Care program.
I'm here today representing SUNY and also CUNY Campus Child Care providers and the SUNY Central. As a matter of fact, I was at a meeting at SUNY Central and they asked me to come over here and thank you. So I thought that might be a welcome change from having some demands made upon you. However, since some of you, at least up there, know me, I will probably include some demands too. And certainly support some of the things that I've been hearing from other people. I can never confine myself just to campus child care because I've been interested in child care in general and services for children and families in general for a long time. I certainly want to reinforce the idea that family daycare needs more support, more training and more support systems. We know we need family daycare. We know we have about a 60% turnover every year in family daycare. Most of us who work with children and families are very concerned about that. The centers and the problems that they have and the 40% turnover they have and the lack of the salary enhancement money, all of those things that I've been hearing are very real problems, and we appreciate the fact that this federal money, we worked for 3 years, many of us very vigorously trying to get this child care block grant bill passed, and we are pleased that New York is getting this money and that you all are going to make good use of it. As far as campus child care is concerned, sometimes there's a misunderstanding. The campus child care people, the student parents, are also mostly low income and very low income people who are struggling to try to make a better life for themselves and their children. I've worked with many job training programs over the years, with Head Start programs. Some job training programs didn't lead to jobs. Some of them led to low-income jobs that still made people qualify for food stamps and welfare. Getting a college degree is one way of helping a family really become self-sufficient and make a decent living for themselves and contribute to society. It's an economic benefit for us as well as an opportunity for them. So campus child care has been a really big affirmative action issue for many of us. We really feel that access to college education is important. Also, some of the money, because it's always so limited, has been limited to purely vocational programs at community colleges, and there was a good rationale for that since the money was limited. This federal money, however, gives us a chance to do something a little bit less discriminatory. Poor people, low-income people, people who are struggling. For instance, in our program, we have an early childhood program at Cobleskill, and if they graduate with a 2-year degree, they go out into child care or Head Start, and they make, again, $5 an hour, $6 an hour. They're struggling with their families. If they go on to a 4-year school and become a certified teacher, that's a different thing in terms of fringe benefits and in terms of salary. But many times there's been difficulty in getting those benefits transferred. We've been very fortunate that the legislature has given us some money for SUNY Child Care that's made it possible for some of our students, for instance, to go from Cobleskill to Oneonta and to continue to receive child care, which they wouldn't under welfare provisions, DSS provisions. We're pleased, therefore, and we're grateful to you for making possible a direct transfer, as I understand it in the plan, to SUNY and CUNY, so that this broad eligibility for students will be able to be continued, so that they can continue in both 2-year and 4-year programs and get child care support while they're doing that. That's going to be a big advantage. It's also an advantage, and I'm thinking of the salary enhancement money now, some of our counties either weren't eligible for or didn't accept salary enhancement money for a couple of years, and our campus child care people are just as beleaguered and just as poorly paid on many campuses as community child care people, and we couldn't get access to that money for 2 full years to help the situation. CUNY and SUNY already have oversight from the Division of Budget, the Legislative Commission on Expenditure Review, from the State Department of Education. In other words, we are accountable. We have a lot of people who are monitoring what we do. And to add another needless bureaucratic procedures to that seems to us another hardship on parents that already are struggling trying to go to school and cope with all of these things. Our financial aid offices are very well equipped to determine eligibility, and we do work with DSS many times closely on that. So we wanted to encourage you to keep that provision in the plan and to make it possible for us to receive that money and to do with it the wise kinds of things that we think are possible with that direct transfer. So we thank you for including that in your plan. We did talk to Division of Budget and Department of Social Services people earlier. I'm sure that all of the low-income students on our campuses will be grateful also, and that I'm speaking for them too.
Any questions? Thank you. Is there anyone that we might have missed who would like an opportunity to testify? Going once? Okay. Thank you very much for coming today to express your views on the plan and make recommendations for change or additions. We appreciate the time and the thought that went into the testimony today.